Now to Capitol Hill and a new push to keep prescription drug prices down. Last month, Congress announced two pieces of bipartisan legislation aimed at keeping the prescription drug market competitive and increasing transparency for patients. Around the same time, CVS Caremark announced it is changing the way they price their prescription drugs by simplifying the formula. But will any of this actually be helpful for patients? Let's bring in Antonio Chachia to discuss, president of 3 Axis Advisors, which is a healthcare research company. Thanks for joining us today, Antonio.
Great to be with you.
So if you could start, this whole system is very complicated and it's not exactly transparent, as we mentioned. So can you kind of briefly describe how the system works and how the price of a particular drug is even determined?
Yeah, in traditional marketplaces, when we want something cheap, we go out and find it, and we try and get it at the best price possible as consumers. However, the prescription drug supply chain, traditional rules don't apply. Most of us buy our medicines through our employers or a government program where we work with private insurers and little-known intermediaries known as pharmacy benefit managers, or PBMs. Those PBMs determine which drugs will be covered under our benefits plans and which ones won't. Oftentimes, they don't seek out the cheapest, most affordable options for us as consumers. Instead, they get big kickbacks from drug manufacturers in exchange for covering more expensive versions of otherwise cheap medicines. So oftentimes, competition actually drives up prices in a means to increase the amount of kickbacks that go back to the PBMs, while we as consumers all pay more.
So the PBMs are kind of a middleman. Are these massive companies? Are there some that sort of have monopolized the power? Who are the PBMs?
Well, PBMs started as lean, mean claims processing machines back in the 60s. They were brought in to act as necessary friction and pushback against pharmacies and drug manufacturers who left to their own devices would love to charge as much as they could get away with. Today, the largest PBMs are part of the largest health insurance companies. They are Fortune 50 companies. They are larger than the drug manufacturers and pharmacy companies they were hired to control.
So is this whole formula, is this whole setup the main reason those prices are so high, or are there some other factors playing a role here?
A big part of the problem is the fact that PBMs make more money when drug prices go up. Because they're getting these rebates and kickbacks back from drug manufacturers, they're paid as a percentage of the list price of the medicine. So PBMs make more money when the prices are higher. So we see routine instances where a PBM will cover a very expensive brand version of a medicine, while cheap biosimilar or generics are actually not covered whatsoever, and the patient is forced to pay or significant amount out of pocket for the expensive brand name drugs. Addressing this fundamental flaw in the middle of our drug distribution channel is essential if we ever want competition to yield lower prices in the marketplace.
Yeah, so who is looking out for the regular person, the patient here, paying these prices? There have been a couple pieces of legislation, the Protecting Patients Against PBM Abuse Act and the Patients Before Middlemen Act. Do those bills have any teeth, and do you think there's any momentum to really get them done?
Absolutely. I mean, every major committee of jurisdiction in Congress right now has PBMs and health insurance companies under their microscope because they're supposed to make the problem better, not make it worse. And so you have two major pieces of legislation that are kind of inching their way to the goal line where we expect that they'll pass. They would aim to delink PBM compensation off the list prices of medicine and outlaw a practice known as spread pricing, where a PBM will pay a pharmacy one rate and bill a different rate back to a state Medicaid program and pocket the difference. The good news for Michigan, they outlawed that practice at a state level years ago, but other states continue to be plagued by the multi-millions of dollars that are taken out of the system through this secretive practice called spread pricing.
Seems like this is one of those few rare issues that there really is some bipartisan support for. Do you see that growing?
Without question. I mean, look, when it's campaign season, lawmakers love to come back home to the local county fairs and stand up at podiums and say that they're going to do something about prescription drug prices. The truth is we have a very convoluted drug distribution channel, and everybody wants to make more money off the high prices of medicines. Manufacturers, wholesalers, pharmacies, PBMs, and health insurance companies, and a million intermediaries I didn't get to mention. The truth is that the prices we pay as consumers are ultimately determined by PBMs and our health insurance companies. So it's essentially where the rubber meets the road. As such, Congress and the Federal Trade Commission have really put a laser focus on how the PBMs are inventing prices at the pharmacy counter.
So I mentioned earlier, CVS announced a new strategy or policy maybe a month or so ago that they're changing their whole pricing formula. Some critics are saying that's just talk, it's just theatrics. Would you agree with that?
Yeah, I would call it cost plus fakery. Right now, a lot of people in this marketplace are gravitating towards the buzz and the disruption that Mark Cuban's cost plus drug company has created in the system. Now, a lot of people pay attention to Mark Cuban because he's, a loud billionaire who owns a basketball team. But the reality is that there's actual substance behind all that style. What Mark Cuban is doing is rather straightforward. He takes the price of the drug, buys it as cheap as he can, and has a straight, transparent markup on top of that. PBMs and health insurance companies have historically operated with much more opaque ways, essentially inventing prices really low and sometimes really high, but making a lot of money along the way. Because of that pressure, everyone in this marketplace is pretending to try and replicate what Mark Cuban is doing, but they don't actually want to provide savings. So they're calling it cost plus, even though it is not cost plus like Mark Cuban is doing today.
So what are some other solutions? Is it just a matter of time before some other companies try to do the same, or do you have to be a billionaire to pull something like that off?
Sometimes I feel like you do have to be a billionaire to pull it off, and you have to engage in what we call compassionate capitalism, which is what I think Cuban is trying to achieve. But there are some health plans that are taking notice and trying to change. Blue Shield of California, one of the largest state plans in the country, very publicly fired their PBM last year and is moving towards a more disruptive model with better aligned partners who actually are going to work to lower costs. There's a little bit of a copycat going on from employers and benefits consultants and Medicaid programs. Everybody keeps hiring the same people and expecting different results. We know we have a drug pricing problem in the United States, but we're not going to get rid of it when we keep hiring the same for-profit actors. I think we're starting to see glimmers of hope that the marketplace will actually start to change some of this, but I think public policy has a necessary role in calibrating a greater equilibrium in the marketplace and at least better transparency.
All right, well, this has all been very informative and encouraging that there are at least some glimmers of hope going forward. Antonio Chachia, president of 3 Axis Advisors, thanks so much for joining us today.
Thanks for having me.